Dear friends, happy evening to all. I am yours, Dr.T.Diwagar, B.P.T. MAAP. Today, let us discuss about stroke and what is neuroplasticity. Okay, first of all, how the stroke will occur. Actually, the stroke named as ischemic stroke and hemorrhagic stroke. First of all, I am explaining about a very easy method. Okay, actually, human being, we are having a blood vessels. So the black occurred on blood vessels. So due to the lack of blood supply to a brain. So the decreased blood supply to the brain cells. So automatically people are getting stroke attack. Again I will explain. Each and everybody, you are having your own house, you are having a plumbing system, that means pipe. If any black in your pipe now, automatically you are not getting water because of due to the pipe black. The same thing, human being blood vessels also just like a plumbing system. So the black due to any nicotine or any cholesterol, lipid, anything, due to the black, the blood supply does not go to the brain cells. So the immediately brain cells goes to the degeneration. Degeneration means brain cells death. If brain cells death na, the regeneration is not possible. Degeneration means cell death. Regeneration means regrowth. The brain cells once degeneration na, regeneration is not possible. This is the real theory aspect of brain cells. So once brain cells degenerate na, regeneration is not possible. Actually, due to the rupture of blood vessels, sometimes hemorrhagic stroke means due to the rupture of blood vessel, the blood leaked from blood vessels. So blood leakage in your brain cells. So that's all. Due to the leakage of blood cells in your brain, automatically people are getting stroke attack. So the neurologist, they are finding what type of stroke, ischemic stroke or hemorrhagic stroke, like that. First they are diagnosed, then depends upon the condition, depends upon the diagnosis, they are treating the patients. So people immediately check if you are having slurring of speech, mouth deviation, then ask the patient to raise your arms. Actually, if patients are getting affected now, affected limb does not rise. So you have to check this kind of symptoms. Patients are having severe headache and mouth deviation, like this mouth deviation, and ask the patient to raise your both hands. If one hand rise, another hand does not rise now, automatically patients are having stroke. Immediately go to the multi-speciality hospital and immediately take MRI, magnetic resonance imaging, and find out the cause of the stroke. Then immediately treat the patient, because if you are late now, brain cells death, it will be increased. Brain cells degenerated, it will be increased. So if over degeneration now, patients are getting severe stroke. So initial period of treatment should be essential and important. It will save the patient life, it will save the patient function. So after the stroke, physiotherapist, we are given a treatment. So before that, I am given some theoretical points. Actually, patients are having right side black, right side stroke na, patients are having right side problem in brain na, patients are getting left side stroke. Why? Because of decussation of nerve fibers. Right side brain control the left side brain, left side brain it control the right side brain. So this is the theory. So if people are having right side problem na, left side people are getting stroke attack. If people are having left side stroke na, left side problem na, patients are getting right side stroke. So this is the basic criteria. Actually, neurologists, they are given medication for black. If patients are having black na, they are given atorvastatin, ecosprin, like that. So then patients are having hemorrhagic stroke na, they are given some medication to arrest the hemorrhagics. After that, physiotherapist, we are given physiotherapy treatment. Once brain cells degeneration na, regeneration, it will not occur. So physiotherapist, actually brain cells, what is the function of brain cells? If I am speaking, if I am doing the finger movements, hand movements, I am speaking and I am seeing, I am respirating, everything controlled by the brain cells. So brain cells, it will be very essential. If brain cells degeneration, patients are getting paralytic attack with bladder and bowel problem. The patient cannot pass the urine. Somebody is over urination. Some patients are getting over urination and they are lost finger movements and they are losing recognition power also. That means so everything by brain cells. Brain cells once degeneration, regeneration is not possible. So physiotherapist, we are given movement and we are given training. So that will restore the brain cells. Actually, brain cells, if degeneration, that areas surrounded by scar tissues. So the nearest cells, it restore the functions. When physiotherapists are doing the movement, the nearest brain cell that observe that movements, that is called as neuroplasticity. I hope all are understood about what is neuroplasticity. Actually, there is no medicine for stroke attack. Physiotherapy is the only treatment for stroke attack. How now? Because if brain cells are degenerated, regeneration is not possible. So when we are given physiotherapy movements, when we are given physiotherapy treatment, it will restore the brain cells. So affected area, that should be surrounded by scar tissues. So affected area is the always affected area. That area are not having any sensation. So the nearest cells, they are restore the movement. So the restoration of movement is the neuroplasticity. So physiotherapy is the only treatment and first treatment for the stroke patient. When patients are getting a stroke attack, so that patients automatically they went to the muscle power 0. From muscle power 0 to muscle power 5, physiotherapists are doing main role in the treatment of the stroke attack. We are given PNF, proprioceptive neuromuscular facilitation technique, neurodevelopmental technique, nerve gliding technique, tendon gliding technique, stretching technique, and cryotherapies. Everything essential for the stroke patients. Lots of people. Then again, I want to say something. The initial period of the treatment should be very, 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 very essential, because from 0 month to the 1 year period, within 1 year period is the very essential period. So initial treatment should be must. If you are not given proper treatment, patients are getting residual paralysis. They are having some impairment. They are having some impairments and residual paralytic attack. So initial treatment. Actually, when discharged from the hospital, patients when discharged from the hospital, immediately search physiotherapist and take physiotherapy treatment, because of the initial period of the treatment should be very essential. If you lost, you are getting some residual paralysis. Residual paralysis means you are not getting full recovery. You are getting some tightness. You are getting some deformity in your limb. So initial period of the physiotherapy treatment should be essential. Don't get weekly once or twice physiotherapy treatment. Regular physiotherapy treatment should be very essential. Lots of people, they are not following physiotherapy. They are going to the oil massage, some traditional methods like that. Then they are actually, it's not a good. Don't go to the traditional centers, traditional practitioners. Go and take physiotherapy treatment from the qualified physiotherapy doctors. Then only you are getting proper recovery. I hope all are understood about what is stroke attack, what is the treatment. If you are having any difficulty now, immediately go to the multi-specialty hospital and get a consultation with neurologist and physiotherapist. Thank you so much. Bye bye.